Have you been told type 2 diabetes is a chronic and progressive disease? One you'll struggle with forever? Well, Dr. Jason Fung disagrees, and today I'm breaking down his powerful approach that's changing lives across the world. In this video, you'll uncover the real causes of diabetes, why current treatments often fail, and what you can do right now to take control of your blood sugar and your health. If you want to discover the truth about insulin, diabetes, and how to truly reverse it, keep watching. First, let's take a quick look. Who is Dr. Jason Fung? Who is Dr. Jason Fung? Dr. Jason Fung is a Canadian nephrologist that's a specialist in kidney medicine, who has become one of the world's leading voices in the fight against diabetes, obesity, and metabolic diseases. He's the author of best-selling books like The Diabetes Code and The Obesity Code, and he's helped thousands of people use natural, food-based approaches to not only manage but often completely reverse type 2 diabetes. His work focuses on teaching people how to regain their metabolic health by understanding the real drivers behind insulin resistance and high blood sugar. So let's start the video. Don't forget to subscribe our channel. What really causes type 2 diabetes? So what actually causes type 2 diabetes? According to Dr. Fung, the real villain isn't just sugar itself, but a hormone called insulin. Insulin helps our bodies move sugar from the blood into our cells. However, when we eat too many sugary or carbohydrate-rich foods over many years, our insulin levels remain constantly high. Over time, our cells stop listening to insulin's message. They become resistant. This is called insulin resistance, and it forces the body to produce even more insulin, creating a vicious cycle. Dr. Fung calls this process hyperinsulinemia, and he explains that it's the underlying cause not just of type 2 diabetes, but also for weight gain and many other health problems. Most people think diabetes is simply a problem of high blood sugar, but Dr. Fung teaches that it's actually a disease of too much insulin in the body. Why traditional treatments don't work? Let's talk about how type 2 diabetes is usually treated. Most doctors focus on lowering blood sugar by prescribing medications, including insulin injections. But Dr. Fung asks a simple question. If you give more and more insulin, aren't you just treating the symptom, not the root cause? In reality, excess insulin drives the body to store more fat, especially around the belly and internal organs, making insulin resistance even worse. That's why, sadly, many people see their medications go up year after year, even as their health declines. Dr. Fung's message is urgent. For real progress, we must lower insulin, not just sugar. This is why so many people get stuck on the medication treadmill and never really get better. The power of dietary change. So what can you do differently? Dr. Fung stresses the importance of food choices. Instead of counting calories or simply adding more medications, he recommends a radical shift toward eating whole, real foods. Here are some practical tips inspired by Dr. Fung's teachings. Cut out added sugars. Skip the sodas, desserts, and sugary snacks. Avoid refined carbohydrates like white bread, white rice, pasta, and packaged cereals. Build your meals around healthy proteins. Think eggs, fish, meats, and natural fats like olive oil, avocados, and nuts. Load your plate with non-starchy vegetables, spinach, broccoli, cucumbers, and more. By focusing on foods that don't spike your insulin, you give your pancreas and body a chance to recover. Over time, insulin resistance can decrease, leading to much better blood sugar control. Intermittent fasting, a key tool. But Dr. Fung is perhaps most famous for popularizing intermittent fasting. Why is this so powerful? When you take regular breaks from eating, like skipping breakfast a few days a week or not eating after dinner until lunchtime, you let your body's insulin levels finally fall. This triggers your body to start burning stored sugar and fat for energy. Fasting isn't starvation. It's a natural state our ancestors often experienced. Clinical studies have shown that with supervised intermittent fasting, many people can dramatically reduce or even eliminate their diabetes medications, sometimes in just a few months. Fasting protocols can be as simple as 16 to 8, fast for 16 hours, eat within an 8-hour window, or doing a 24-hour fast once or twice a week if you feel comfortable. Is diabetes really reversible? Here's the most inspiring news. Type 2 diabetes is often reversible. Dr. Fung and other experts have documented hundreds of cases where patients, by lowering their insulin and breaking the cycle of constant eating, have seen their blood sugar return to normal ranges. Even people who've depended on insulin for years have noticed massive improvements, dropping medications, feeling more energetic, and reclaiming their lives. While results can vary, the evidence shows that type 2 diabetes does not need to be a lifelong sentence. Practical steps and final thought. How can you start putting these ideas into action? Start by cutting out sweetened drinks, pastries, and processed foods. Choose meals based on real, unprocessed ingredients. Consider trying intermittent fasting, beginning with 12 hours overnight and building up to 16 or more. Always talk to your healthcare provider before making big changes. Track your own progress and listen to your body. The key is consistency and patience. Remember, the bad habits didn't develop overnight, and neither does true wellness. Everyone's body is different. So always consult your healthcare provider before changing your diet or starting a fasting routine, especially if you take medication. But know this, real change is possible. If this video inspired you or taught you something new, give it a like, subscribe for more science-backed health content, and comment below if you have questions or want to share your down journey. And if you know somebody struggling with diabetes, please share this video. They deserve hope and real solutions too.